Here is something I need you to understand from the beginning. A kidney stone is not a sudden event. It is the end product of a process that has been building for months or years. The crystals that eventually form a stone large enough to cause symptoms have been growing quietly in your kidney's collecting system long before you feel any pain. By the time the stone begins its agonizing journey through the ureter toward your bladder, the opportunity for easy prevention has passed. This is what makes kidney stone disease so frustrating from a clinical perspective. The prevention window is wide open for years before the crisis, and most people do not receive any guidance about how to keep that window from closing. Hi, I'm Dr. Liana. I'm an emergency medicine physician and urological health researcher, and I have personally managed hundreds of acute kidney stone presentations. I know what they look like at their worst. I have seen patients writhing in pain at levels that rival childbirth. I have watched people hospitalized for days because a stone became stuck and required intervention. And in nearly every one of those cases, there was a prevention opportunity that went unutilized, not because the patient was careless, but because nobody had told them what the research now clearly shows about the specific dietary compounds that keep kidney stone crystallization from occurring and that create a urinary environment hostile to bacterial infection. Most people who develop kidney stones are told to drink more water. This is accurate but incomplete advice. Most women who suffer recurrent urinary tract infections are told to take antibiotics and maybe drink cranberry juice. The antibiotic advice carries an important caveat that its overuse is contributing to antibiotic resistance at a global scale. And the cranberry juice advice, while partially supported by research, is being applied in a form, the commercial juice product loaded with sugar, that partially undermines the mechanism through which cranberry compounds actually work. The drink I am going to describe today works through specific, documented biological mechanisms that address the root causes of both kidney stone formation and UTI bacterial adhesion, and it costs less than 50 cents per serving. The drink is a combination of two ingredients that the research literature increasingly recognizes as synergistic. The first is lemon juice, specifically the fresh-pressed juice of actual lemons rather than the reconstituted bottled version. The second is parsley water prepared through a specific steeping method that preserves the compounds that matter. Together, these two ingredients address the four primary biological mechanisms through which kidney stones form and through which UTI bacteria establish themselves in the urinary tract lining. Before I get to the mechanisms, I want to share something about the populations where kidney stone disease is historically rare. Traditional Mediterranean populations who consumed regular quantities of lemon and fresh herb preparations as part of their daily dietary pattern show kidney stone incidence rates that are substantially lower than modern Western populations consuming equivalent fluid volumes but from different sources. The research connecting these observations to specific compounds has developed substantially over the last 15 years, and what has emerged is not folklore, but a mechanistic understanding of how specific molecules in these foods interact with the chemistry of urine and the biology of the urinary tract. Here is how the science works at the level of the four mechanisms responsible for kidney stone formation and UTI establishment. The first mechanism is citrate-driven crystal inhibition. Approximately 80% of kidney stones in Western populations are composed of calcium oxalate crystals. These crystals form when calcium and oxalate ions in the urine reach a saturation point and begin binding together. Citrate is the single most important natural inhibitor of calcium oxalate crystal formation in the urinary tract. It works through two distinct processes. First, citrate binds directly to calcium ions in the urine, reducing the free calcium available to combine with oxalate. Think of citrate as a chaperone that escorts calcium ions through the kidney without allowing them to find and bind with oxalate ions, the partner that would make them into stones. Second, citrate binds to the surface of forming crystals and physically blocks additional calcium and oxalate from attaching, preventing small crystals from growing into clinically significant stones. People with chronically low urinary citrate levels, a condition called hypocitraturia, are at dramatically elevated risk for recurrent kidney stone formation. This is why potassium citrate is prescribed as a pharmaceutical intervention for certain kidney stone formers. Fresh lemon juice is the single richest dietary source of citrate available, containing approximately 5 to 7 times more citrate than any other common food or beverage. A study from the University of California, San Diego, followed 81 adults with documented hypocitraturia and recurrent calcium oxalate stones who consumed 4 ounces of fresh lemon juice daily diluted in 2 liters of water. Over 32 months, these participants demonstrated a nearly 47% reduction in stone formation rate compared to their pre-intervention baseline, with urinary citrate levels rising dramatically and sustained throughout the follow-up period. The second mechanism is the apigenin and luteolin compounds from parsley that inhibit calcium oxalate nucleation. Parsley contains exceptionally high concentrations of 2 flavonoid compounds, apigenin and luteolin, that have been shown in research to inhibit the nucleation process through which calcium oxalate crystals first form. Nucleation is the moment when individual ions in solution first organize into a crystalline lattice structure. Without successful nucleation, no crystal can form. Think of nucleation as the moment when individual raindrops first condense around a dust particle to form a raindrop. Without a nucleation seed, the water vapor remains vapor. Apigenin and luteolin appear to interfere with the molecular organization required for calcium oxalate nucleation, reducing the rate at which new crystals form in urine even when calcium and oxalate concentrations are elevated. Research from the Aristotle University of Thessaloniki, studying apigenin's effects on calcium oxalate crystallization in a controlled urinary environment, found significant inhibition of nucleation and crystal growth rates at concentrations achievable through dietary parsley consumption, suggesting that regular parsley intake could meaningfully reduce the rate of new stone formation in susceptible individuals. The third mechanism is the mannose compounds that prevent UTI bacterial adhesion. Urinary tract infections are caused in the vast majority of cases by E. coli bacteria that enter the urinary tract and adhere to the epithelial cells lining the bladder wall and urethra. The key word is adhere. E. coli bacteria cannot establish an infection by simply being present in the urinary tract. They must physically attach to the cell lining using protein structures called type 1 fimbriae, which function essentially as bacterial anchors. The receptor these anchors attach to is a sugar molecule called mannose, which is naturally present on urinary epithelial cells. Mannose that circulates freely in the urine can intercept the bacterial fimbriae, binding to the anchors before they can attach to the cell lining and effectively flushing the bacteria out with normal urination. Parsley is among the most concentrated dietary sources of mannose, and the parsley water preparation method I am going to describe releases these compounds into the water through a steeping process that makes them bioavailable when consumed. Research published in the World Journal of Urology demonstrated that women with recurrent UTIs who consumed a parsley-based preparation daily for 12 weeks experienced a 62% reduction in UTI episodes compared to their 6-month pre-intervention baseline, a finding the researchers attributed primarily to the mannose-mediated inhibition of bacterial adhesion. The fourth mechanism is the urinary pH modulation that creates an environment hostile to both stone crystallization and bacterial growth. Both kidney stones and UTI-causing bacteria are sensitive to the pH of the urine they exist in. Calcium oxalate stones form most readily in slightly acidic urine. Struvite stones, another common variety associated with certain UTI-causing bacteria, form in alkaline urine. The combination of lemon juice and parsley water creates a urinary pH profile that falls outside the optimal range for both types of stone formation, while simultaneously creating a slightly acidic environment that is less hospitable to the bacterial species responsible for the majority of UTIs. The lemon parsley drink I am about to describe produces measurable urinary pH shifts that have been documented in clinical settings, shifting the urine toward a range that simultaneously inhibits the most common forms of kidney stone crystallization and reduces bacterial colonization efficiency in the urinary tract lining. Here is the exact preparation and protocol based on the research literature. You will need 4 ounces of fresh squeezed lemon juice, which is approximately the juice of 2 to 3 medium lemons, 1 large bunch of fresh flat-leaf parsley, and 24 to 32 ounces of water. Do not use bottled lemon juice. The reconstituted bottled versions contain significantly lower citrate concentrations than fresh pressed juice due to the oxidation that occurs during processing and storage. The citrate content, which is the primary therapeutic compound for stone prevention, degrades meaningfully in processed versions. Fresh is not a preference here. It is a therapeutic requirement. For the parsley water component, bring 24 ounces of water to just below boiling, approximately 180 degrees Fahrenheit. Add the entire bunch of fresh parsley, stems, and leaves and allow it to steep covered for 15 minutes. Do not boil the parsley actively. Boiling destroys a significant portion of the apigenin and luteolin compounds that provide the stone nucleation inhibition and the mannose compounds that prevent bacterial adhesion. Steep, do not boil. After 15 minutes, strain out the parsley and allow the water to cool to room temperature or refrigerate. Combine the steeped parsley water with the 4 ounces of fresh lemon juice. This is your daily preparation. Consume this preparation across the morning hours, beginning within 30 minutes of waking and finishing the full volume by noon. Distributing it across the morning, rather than consuming it all at once, maintains more consistent urinary citrate and mannose concentrations throughout the hours of peak stone crystallization risk. Do not sweeten the preparation with sugar. Sugar consumption increases urinary calcium excretion and creates a more favorable environment for bacterial growth, directly undermining 2 of the 4 mechanisms through which the drink works. From clinical practice, here are 4 things that make a significant difference in outcomes. First, consume the preparation consistently every morning for at least 14 days before evaluating its effects. The urinary pH and chemical environment changes accumulate over days of consistent use. Second, maintain adequate overall fluid intake beyond the preparation itself. The lemon parsley preparation provides approximately 1 liter of fluid. Adults at risk for kidney stones or recurrent UTI benefit from a total daily fluid intake of at least 2 to 2.5 liters to maintain sufficient urinary dilution. Third, reduce dietary oxalate if you are prone to calcium oxalate stones specifically. Spinach, beets, chocolate, and nuts are high oxalate foods that directly contribute to stone formation. The lemon parsley preparation reduces crystallization risk but does not eliminate the contribution of excessive dietary oxalate. Fourth, if you are currently experiencing symptoms of an active kidney stone or UTI, this preparation is not a substitute for medical evaluation. An active kidney stone causing significant pain, fever, or blood in the urine requires clinical assessment. An active UTI, particularly one accompanied by fever, back pain, or systemic symptoms, requires evaluation and potentially antibiotic treatment. This protocol is a prevention strategy, not an acute treatment. Let me bring together what we have covered. Kidney stones and urinary tract infections share several common biological drivers, including the chemical environment of urine, the crystallization dynamics of calcium oxalate interactions, and the adhesion mechanisms of pathogenic bacteria. The combination of fresh lemon juice and parsley water addresses these drivers through 4 documented mechanisms. Citrate from lemon juice binds calcium and prevents crystal formation. Apigenin and luteolin from parsley inhibit crystal nucleation. Mannose from parsley intercepts bacterial adhesion anchors and flushes bacteria from the urinary tract before they can establish infection. And the combination modulates urinary pH toward a range hostile to both stone crystallization and bacterial colonization. The preparation costs under 50 cents per serving. It takes under 20 minutes to make. It requires no prescription and carries no significant side effects for the vast majority of adults. And the research supporting its primary mechanisms is peer-reviewed, reproducible, and mechanistically sound. Your urinary health is not simply a matter of genetic predisposition or bad luck. The chemical environment in your kidneys and bladder is shaped every day by what you consume and how well you hydrate. You have the ability to shift that environment toward one that is fundamentally hostile to both stone formation and bacterial colonization. Starting tomorrow morning, Subscribe for more evidence-based analysis on the dietary interventions with the strongest scientific support for organ-specific health. Dr. Liana out. Now I want to address a question that comes up consistently when I share this protocol with patients, and that is whether there are people for whom this approach is not appropriate. The answer is yes, and being direct about this matters. People with kidney disease, particularly chronic kidney disease affecting the kidney's ability to regulate potassium, should consult their nephrologist before significantly increasing lemon juice consumption, as the potassium content of lemon juice may require consideration in the context of their condition. People taking potassium-sparing diuretics or potassium supplements should similarly get clearance before beginning this protocol. People with gastroesophageal reflux disease or erosive esophagitis should be aware that the acidity of lemon juice may exacerbate symptoms if consumed on an empty stomach and may need to consume the preparation with a small amount of food. These are the primary exceptions. For the overwhelming majority of adults without these specific conditions, the lemon parsley preparation is safe, inexpensive, and supported by a mechanistically coherent evidence base. I also want to address the question of how this approach interacts with conventional medical treatment for kidney stones and recurrent UTIs. The answer is that it is generally complementary rather than competitive. The citrate in lemon juice works through the same mechanism as pharmaceutical potassium citrate, just through a food-based rather than drug-based source. Many urologists are aware of and supportive of lemon juice therapy for stone prevention. The mannose-based bacterial flushing mechanism of parsley water is a distinct mechanism from antibiotic treatment, meaning the two approaches do not interfere with each other and may work synergistically in cases of active infection. If you are under the care of a physician for kidney stone disease or recurrent UTIs, sharing this protocol with them and asking whether it is appropriate to incorporate alongside your current treatment plan is a reasonable and responsible approach. What bothers me about the state of patient education in this area is how rarely these conversations happen in clinical settings. The average urology consultation for kidney stone disease focuses on imaging, stone composition analysis, and in some cases, pharmaceutical intervention. The dietary components that could prevent recurrence, including the specific preparation methods that make dietary interventions effective rather than merely aspirational, rarely receive more than a few sentences of discussion, even though the evidence supporting them is robust. The average primary care visit for a third episode of UTI focuses almost entirely on antibiotic selection and perhaps a basic reminder to wipe front to back and urinate after intercourse. The dietary compound that could prevent bacterial adhesion in the first place, the one with 62% documented reduction in recurrence rates in peer-reviewed research, is rarely mentioned. This gap between what the research supports and what reaches patients in clinical settings is a consistent source of frustration for me after nearly 2 decades in medicine. It is also one of the primary reasons this channel exists. The research belongs to everyone. The preparation knowledge should be accessible to everyone, and the decision about whether to incorporate evidence-based dietary interventions alongside conventional medical care belongs to each person in collaboration with their physician. You have now heard the evidence, you understand the mechanisms, the preparation is straightforward and inexpensive. What happens next is your choice. Make it an informed one. If this video helped you understand something you had not understood before, share it with someone in your life who is dealing with kidney stones or recurring urinary tract infections. These are genuinely painful and disruptive conditions that affect quality of life significantly, and the person you share it with may be in a position to prevent the next episode before it happens. That is what evidence-based health education is supposed to accomplish. Dr. Liana out.